Emily Willis's lawyers have revealed that the actress is permanently disabled following her treatment for a ketamine addiction at a Malibu rehab center, according to a lawsuit that's just been filed. The lawsuit names Summit Malibu and its parent company, Malibu Lighthouse Treatment Centers, LLC. The lawsuit claims that Summit Malibu and its parent company have abused a dependent adult, engaged in professional negligence, and fraudulent business practices. The lawsuit reveals that Emily is still in a semi-comatose state after suffering severe brain damage from a cardiac arrest at Summit Malibu Treatment Center. Instead of keeping a close eye on the actress, whose real name is Litzy Lara Banuelos, as they promised in their intake documents, the lawsuit says staff watched Emily's health get worse over several days, but didn't send her to the hospital for more advanced care. The suit says that on February 4, 2024, a nurse practitioner found her unconscious. While it's not clear how long she'd been out before being found, the nurse called 911, started CPR, and called for backup. The paramedics that arrived on the scene performed CPR for about 30 to 40 minutes before they were able to get a heartbeat, but by then, Emily had been without oxygen for such a long time that she was in a coma. The Cooper versus Malibu Treatment Centers and Summit Malibu lawsuit was filed on December 27, 2024 in the Los Angeles County Superior Court. It says, had the staff followed standard medical protocols, Emily would have had the chance to get her life back, said her lawyer, James A. Morris Jr. of the Morris Law Firm. He's working with Emily and her mother and guardian, Yesenia Lara Cooper. No patient should ever be subjected to such a horrendous breakdown in clinical care. Her health was ignored until it was too late, and now her life is forever changed. Emily checked into a rehab center overlooking the Pacific Ocean on January 27, 2024, because of her ketamine addiction, according to some reports. She was using 5 to 6 grams a day for about a year, according to the document. She was dealing with bladder inflammation, urinary incontinence, and night terrors. She had a history of depression, anxiety, and PTSD, and she was on meds for all of that. Drug tests showed that Emily wasn't on ketamine or other drugs when she checked in, and she weighed 100 low Bs, not the 80 low Bs that had been reported. She kept testing clean over the next few days, but her overall health was getting worse according to the lawsuit. The lawsuit says she was disheveled, frail, disoriented, with a nervous mood and poor insight and behavior. It also says she had difficulty walking, barely ate, didn't shower or get dressed, and experienced aches, tremors, spasms, and weakness. It seemed she was in pain. Morris said, eventually she was so dehydrated that a nurse couldn't measure her blood pressure. By this time, her acute medical distress had been recorded, and yet they left the decision to go to urgent care up to a patient who was suffering incredible pain and couldn't care for her own well-being. There's no excuse for their failure to provide her with the medical and psychological care she needed. The suit says that 26 hours later, Emily had a cardiac arrest and is now in a vegetative state. She's said to have since come around and can track things with her eyes, but she can't move or speak. She's still in a care home in Utah. Morris added, "We hope this lawsuit will spur real change in how treatment centers handle critical cases. Too many patients who should be receiving life-saving interventions are being lost to negligence. This lawsuit helps us understand what really happened to her and what led to her current state of health." Well, that's all for today. Thanks for tuning in. See you in the next one.